Take Back Your Health Now, Episode 3. You're listening to the Take Back Your Health Now podcast, the show that interviews the top doctors, athletes, trainers, and entrepreneurs to help you find the holy grail of health. Now here's your host, Dr. Dan Margolin.
Hi, this is Dr. Dan Margolin with Take Back Your Health Now, the show where we pull out all the stops in search of health's holy grail. Today's guests it's going to be an exciting show. We have Dr. Stanley Stanbridge and Mr. Jeff Maier. They are the inventors of rapid release therapy. Let me read you their bio here. Dr. Stanbridge is a practicing chiropractor since 1978. Dr. Stanbridge is focused on pain and relieving suffering in a non-surgical, holistic way. He's an early adopter of vibrational medicine. Dr. Stanbridge investigated high-speed vibrations that would resonate with scar tissue and the combined effects of arc motion with the shearing force of planar waves. Immediate and lasting results with patients who had suffered chronically with issues led to the formation, along with co-founder Jeff Maier, an accomplished inventor and sales professional of rapid release therapy, which today is poised to become the go-to therapy for physical therapists, chiropractors, sports trainers, and the health and medical community in general. Dr. Stanbridge, Jeff, how are you guys?
Doing great, thanks.
Wonderful.
Excellent. Thank you for having us on.
Oh, it's our pleasure. We're excited to have you on. So, let's just jump in. What is rapid release therapy?
Rapid release therapy, or the technology, is targeted high-speed vibration that, when it's applied to the body, targets scar tissue adhesions. It resonates with those hard, immovable tissues to the point where they will begin to break up once they're exposed to that high intensity vibration. So it's the best way to kind of get a visual of that is when the opera singer hits the right note and she shatters the wine glass.
Right.
It's because she's hit a certain frequency that resonates with that wine glass.
Wow.
Everything has a resonant frequency. So when these vibrations start traveling through the body at this frequency that we use, it will target the scar tissue and begin to break it up, thus restoring mobility and relieving pain, because that scar tissue is attached to healthy tissue. When you try to move your arm or pull against that scar tissue, it's anchored into healthy tissue and it causes a lot of pain.
Right.
If those adhesions are gone, boy, you get your range of motion back and the pain level goes way down. And there are other effects as well. There's the targeted, the tonic vibration reflex, which elicits and triggers it's a reflex. You can't stop it from happening. It instantly relaxes muscles because of the frequency that we use. And so the overall feeling that the person gets even after a short session is quite remarkable. It's not like anything else.
Now, I don't know if you know this. We actually, in my practice, we do use it, and we've had some great success with it. So I actually am quite familiar with the therapy. So here's my question, though. How did you discover this application for vibrational technology? Like, how did you actually come up with the right vibration? How did you figure this out?
Well, with the name of your show and it kind of the holy, seeking the holy grail of health, and with my exposure to a number of different modalities and investigating other kinds of therapies, inventing other therapies, I was left with this kind of nagging idea that there had to be something that could be used with no side effects, that the person didn't really have to have a lot of training, a lot of time and effort invested into a profession or whatever. They could actually use a tool that, if it was used properly, could have a beneficial effect to a wide number of people. And so these are the thoughts that are going through my mind, and I'm asking myself questions. Well, what if I did this? What if I used it this way? What if I, and ultimately got to the point where I made the first device strictly out of curiosity. What would happen if we did this? And after some failures, made the first device, took it into my office the next day, telling patients, hey, I put this together. It feels really good. Can I use it on your shoulder? Can I use it on your carpal tunnel? Can I use it on your knee?
Right, that was going to be my question. Like, what are you using it on, right? Like, what would be like some of the more common things you initially started using it on?
Initially, had great success with particularly rotator cuff injuries of the shoulder and carpal tunnel type symptoms.
Wow.
And the results were jaw-dropping. I mean, I would see things that I'd been in practice for 30 years at this point. I had never seen anything work so well, so quickly, and it lasted. Like, I would see a patient on a Monday, their shoulder improved vastly. They would come in on Wednesday, and we're talking 5-10-year-old conditions.
Wow.
They're coming in, moving their arms and the shoulders like, I don't know what you did, doc, but I haven't felt this good in 10 years. And very good, long-lasting, stable changes.
Yeah, prior to the rapid release, like what for the shoulder, like what would have been the treatment? Would it have gone to surgery? Would they have done cortisone injections? Like what else would they have done to try to free it up?
A lot of, whether it's a chiropractic visits, whether it's physical therapy, surgeries, of course, cortisone injections, and I would see people with histories of being to other chiropractors, being to physical therapists, being to the surgeon, taking the drugs, getting the shots, and nothing was working. And without any exaggeration, within minutes, they're seeing changes that nothing else produced.
Wow. Well, listen, I remember years ago having a patient with carpal tunnel syndrome that was going to have surgery, and we referred her to a chiropractor just to get some adjustment. And you know what? It actually cured it, and she canceled the surgery. So I've heard some remarkable things. And, just in having used your rapid release, I mean, I've just seen things like sort of unbelievable. I have a question, though. Like, if I were to talk to, like, the audience and say, well, or explain to them, how does this differ from, like, the massager that I have at home? Or how does it differ from that?
Well, what we use is targeted high-speed vibration. And we have a very small stroke. It's only about a 1/16 of an inch, but it's moving very fast. So even though you can't even see it moving really, right, it feels very vigorous. But it's safe enough to use on just about any part of your body. So even someone that's in like a acute car accident or acute sprained ankle, where it hurts to the touch, but for some reason rapid release seems to be able to go over it without triggering pain for them.
So you could have somebody with an acute injury that you could actually use it on without really being worried, obviously if there's no fracture or something underlying it, but without really worrying about irritating the person or damaging the tissues?
Right, because they're typically in like a muscle guarding mode, and which is the same physical mechanism as cramps and spasms. And it's very painful, but like for example, the hockey teams love it because the guy gets slammed into the boards, he comes kind of limping off to the side, and they just fix him up in 30 seconds with rapid release. And I wouldn't have believed it if it didn't happen to me. I got in a bike accident and I couldn't put any weight on my leg. And right. I came back. Luckily, I had the rapid release at home, and I put it on my leg, and I went to see if I could put weight on it. And I couldn't believe it. It was like back to normal that quick.
I mean, so when you're looking at someone's typical results, like how quickly do they feel it? And I guess how long do they last? I mean, is it something that, I don't know, some of the typical things like you talked about shoulders or I guess like shin splints or something like that. Would they feel the results like immediately? And how long would it last from that point on?
Shin splints I'm glad you brought that one up. We have immediate and lasting effect on shin splints. But, to answer your question, it's all over the map. Some people have back pain, you use it, they get immediate relief, but it comes back the next day. Okay. Other people that, maybe have been in a car accident and have had back pain for 20 years, they can get 4 or 5 treatments and get long-lasting relief because we remove that scar tissue that was causing the aches and pains. So it really depends on what the issue is. For example, on tendonitis, we typically get about a 40 or 50% improvement in the pain level after one treatment, and then the next one another 40 to 50%. But it's kind of a diminishing return because tendonitis is not something that we clear on one trip. But, I think if you use it about 3 or 4 treatments and maybe combine it with some stretching or exercise and maybe lay off it a little bit, it does a great job of getting rid of it.
Well, this is probably sort of a strange question, but if you were to say, like, percentage-wise, how much quicker somebody would heal up with some of these injuries, shoulder, back, compared to conventional versus the rapid release, is there any data on, like, how much faster it heals it up?
We did an informal study at Camp Pendleton. The people in the basic training, their injuries, they had lots of data from years of how long it took them to get back on active duty.
Yeah.
And when incorporated rapid release along with their other physical therapy that they were doing, and if you discount the people that broke arms and legs and stuff like that, they were back on track and working with 60% quicker than without using rapid release.
That's
and
tremendous. That's tremendous.
A wide range of injuries.
Wow. When you first discovered these kind of results, you must have been jumping up and down. I mean, that's pretty crazy, right?
Absolutely. And I remember those first patients. I remember those first early days. And a very good friend of mine, a colleague of mine who I'd known for all of my professional career, I began using the rapid release, and I'd pick up the phone and tell him what was happening. Mike, this person with 5 years of rotator cuff injury, pain all day, all night, can't use the arm and shoulder, 5 years of suffering, and it was like 1 or 2 sessions, and it's 95% improved. And then the next day it was an ankle injury. The next day it was a shin splints. The next day it was a hip. The next day it was carpal tunnel.
Wow.
And he got so frustrated with me calling him so excited after 30 years of practice. He said, "Well, build me one."
Wow, wow,
so,
wow,
so
wow.
I went back to my friend's shop, who's a metal fabricator, and I made him one. And pretty soon he's calling me as much as I'm calling him, because after 30 years, neither of us had ever seen, witnessed, or heard of anything that would produce these quick, lasting, painless results.
Wow. Well, Dr. Stanbridge, this has got to be a culmination of a life's work in terms of like really reaching your goal. I've got to assume that you went into chiropractic to help people and find alternative methods and stuff like that. So do you feel like you sort of reached that pinnacle? Like, was this what you were searching for?
Honestly, that is a great question. No one's put a question like that to me before, and I will be honest with you. I can't envision, when it comes to musculoskeletal issues, I can't envision anything working better than what the rapid release is doing. We have a PhD, a physical therapist doctor at the University of Texas Southwestern Medical Center, who's doing clinical trials for us, been doing it for the last year or longer. The preliminary results are phenomenal. His clinicians they walk by every other modality in their clinic,
Right.
and will use the rapid release. And these are not fresh graduates. These are people who are seasoned. They've been in the profession for many years. They go to what works, and invariably they're picking up the rapid release because they know that their patients will see a change rapidly.
And I've got to imagine like just athletes are being drawn to this too for the same reason. I mean, if you're looking at that kind of an increase in getting back to normal, I mean, I would assume it's like a magnet for the sports industry.
Besides the scar tissue adhesions, there's also myofascial, the fascia restrictions, and also a lot of people that work out a lot, and especially weightlifters, they get a little hypoxia in the muscles where they don't have enough oxygen, and all those restrict the ease of movement. And we do demos like just on the hand. I can use rapid release on your hand for about 90 seconds, and then have you open up and close both hands, and it's like one feels like it's like encased in like concrete almost, and the other one just feels free and open and like it's in.
Now, how is it doing that? It's actually getting the blood flow to actually increase to the musculature? Is that how it's working?
Yes, that's one of the ways that it's working, but also just completely relaxing the muscles with the tonic vibration reflex and getting rid of any adhesions and kind of reforming the fascia. We have a lot of people with fascia injuries, which is where a lot of pain comes
Jeff,
from.
do me a favor. Just explain to the audience a little bit just the difference between, I guess, the muscles and the fascia and how they relate to each other, just to define it a little bit more clearly.
Sure. You can think of fascia kind of like you do on an orange. Each little cell in the orange has a fascia wrapping around it, and then each section of the orange has fascia around it, and then the orange itself has the fascia around it. And that's how our muscles are. In fact, if fascia was considered an organ, it would be the biggest organ in our body. And it's really key to our structure and how we move. And not only that, but all the mechanoreceptors and other nociceptors where we feel pain is all in our, mostly all in our fascia. So it's a very critical organ for getting aches and pains out. And that's where the knots are. And going back to the athletes, before they work out, it's really nice to stimulate that blood flow and get a warm up really quick. So you can imagine a pitcher, instead of throwing 20 pitches to warm up, now he only has to throw 10. So he's got 10 more pitches that he can play in the game.
Well, let me ask you a question there. When you came out with this, I mean, this is to some degree revolutionizing that industry, right? Anytime somebody brings something to market that revolutionizes an industry, there's got to be some backlash. So, what did you run into? Any, like, what kind of, like, just you come out with this? Tell me this. Like, how did you? So now you've got this thing, and you're going to bring it out and let people know about it. What was that like?
Well, that's a great question too, because we do have chiropractor customers, physical therapy customers, who almost view it as a threat, because they'll say something like, well, if I get my patients better so quick, that's going to reduce the number of patients I see, my patient visits, my collections. I mean, what if a patient decides to buy it and then I've lost a patient and I've lost the income from that patient coming in to see me regularly? So there's those kinds of things have come up. And the reality is that by having a rapid release in their practice, whether it's a trainer, a physical therapist, a massage therapist, or a chiropractor, by having that device and improving their outcomes, their referrals dramatically increase.
Listen, that's what I've always. Listen, as a podiatrist, I've always thought the same thing. The faster I can get you out of pain, the faster I can get you back, the happier you're going to be, the more people you're going to tell, and actually the bigger I'm going to get. So I understand what you're saying. I can see people's viewpoint, but it never seemed to play out that way. It always played out, listen, you do the best for the patient, and they'll tell a lot of people, and you'll do great. So I could just see this as a wonderful adjunct to any practice.
Absolutely correct.
Now, let me ask you a question. Who could use this? Like, I know podiatrists, chiropractors. Who else? Like, can it be used by pretty much any profession? Or how would my audience find out more about who would actually be able to administer this to them?
That's a great question, Dan. And the bottom line is anybody that's in pain or limited range of motion can benefit from this. And the easiest way is to find a doctor that's close by. And, we've got hundreds of docs just within 20-mile radius of where we are, and we're spreading around the country. But, it's a very quick treatment time, usually about 3 to 5 minutes. And the price ranges from, $20 to $50, depending on your zip code. But, we do have a new personal unit that we're launching right now, too, and it should be ready in about January.
Wow.
So that's, we really want to democratize healthcare, and we kind of want to eliminate the gatekeeper, which is the doctor that decides whether or not you get the treatment. Right. And, whether you want to buy it. In fact, that kind of brings up a story. Sometimes we're at a trade show and we'll fix a doctor's shoulder or the wrist or whatever that they've had problems on for, years, and they won't buy a machine. And we're just kind of scratching our head. It's like, did you see what I saw? Right. This guy's not buying it, and he's depriving his patients of this amazing treatment. And we want to spread this.
Why do you think that is? I know, like, sometimes people they'll see a result and they don't necessarily believe it, or like you think that's just someone like just too skeptical, or why do you think that might be?
Well, in the chiropractic space, I think going back to what Stan said is that it almost works too good. In the physical therapy space, we do the same thing, and someone has a great result, And they'll ask us, well, where's your proof on this? Where's the double-blind studies? And we're kind of scratching our head on that too. It's like,
well, I'll tell you how we found out about it. A physical therapist that is friends of the practice came in with it, very excited. And she said, Dan, would you mind if I started doing this on your doctors? And I'm like, well, sure. And she pulled one of the doctors over who had hallux limitus. In other words, the big toe was jammed up. And she actually did the rapid release on him for about 5 minutes. And he said, Dan, for the rest of the day, he was in nirvana. It worked so well. So that was our first real, that's the first time we'd actually even heard about it. But what was cool was she also brought it there with such a level of excitement. So are you finding that people, the physicians, the physical therapists that are using this are also really getting on board, or really telling a lot of people, are they bringing that excitement to it that you don't often see to some of the treatments?
Yes,
absolutely.
Yes. I was going to say, Jeff, you can take this in a minute, but I was going to say that when we do trade shows, when we go to chiropractic conventions, we've been in business now for about 5 years, and invariably we will have customers, chiropractors, walking up to our booth and stopping by to chat and say hi. And, we're demonstrating the device to people who've never seen it before. And they walk up to the booth and they will say one of two things. I love this thing, or my patients love this. And they will tell the person sitting there getting their first demonstration, they will tell them, and they're strangers, they don't know each other, they will look at them in the eye and say, you have to get this. This thing is amazing.
Word of mouth, best thing, right?
Oh, that we get emails probably on average 2 or 3 a day of people just ecstatic about their treatment or the results that they're getting or the extra cash they're bringing into their practice. And it just makes us feel so good. And I know that's one of the reasons that both me and Stan got in this business. We really want to expand this and really help as many people as we possibly can. That's our goal for our business. And that's why Stan doesn't practice as a chiropractor anymore, because he can touch so many more people's lives with rapid release than he could ever do.
Wow.
Seeing 100 patients
well,
guys,
a day. One of the things that we're looking for, the thing that we're looking for here is really like the holy grail of health, right? So for the audience, we're trying to help them age not only gracefully, but youthfully, right? So Dr. Stanbridge, you've been in practice for 30 years. What would you say are some of the main reasons that people age and like their joints age? And aside from the rapid release, how could they avoid that? How could they avoid those kind of situations?
Well, as we age, the number one reason people die is circulatory related, whether it's arterial or mainly the heart. So as we age, all the other causes of death decrease and circulatory issues increase. So what does that tell me? That tells me that people are not moving enough.
Wow.
The way you exercise your heart is to keep your body in motion. You got to have fresh oxygenated blood to all the muscles of the body. If you're moving, if you're exercising, you're consuming oxygen, the heart has to work a little harder to get that blood flow and the oxygen into those muscles so you can keep doing what you do. If you sit and watch TV, or you sit and you're on your computer, your muscles are getting weaker, your heart is getting weaker. So one thing I would tell everybody, it's very simple and we all hear it every day, but it's true. Get out and walk for half an hour to an hour a day. Do your 10,000 steps. If you do that one thing, you will bypass so many health-related issues.
Wow.
It would be amazing.
And it's funny because you walk around and you see people that they don't look that healthy anymore. We're living in a world where there's so much money put into healthcare and all that, and I just see among patients, it almost seems to me like patients are getting sicker and sicker. Have you noticed that yourself?
Yes, I agree, and it goes back to a sedentary life and lifestyle.
Wow. Well, I think what you guys are doing is actually combating that by making people pain-free when they're walking and actually allowing them to be more active. Dr. Stanbridge and Jeff, how would people find out more about you if they wanted to get in touch with you, or if they wanted to learn more about the rapid release? How would they do that?
I just search for rapid release on Google, and you'll see we'll have about the first 20 pages there. And we do have a page specifically for people that are in pain and how to help them get out of pain.
Wonderful. Well, Dr. Stanbridge, Jeff Maier, thank you so much for joining us. This has been an awesome interview. I really appreciate it. I think it's given people some great information, and I'm sure some of them will be contacting you about it. And I thank you so much for your time.
Thank you, Dr.
Margolin.
This episode is sponsored by New Jersey Foot and Ankle Center in Orodo, New Jersey. Remember, when you have a foot problem, you've got a foot doctor in the family. Weekend and evening appointments are available. Call us at 201-261-9445. Once again, that's 201-261-9445. Thanks for listening. Check out the show notes over at drdanspeaks.com. If you're loving the show, head over to iTunes and leave us a review, and we'll catch you next time. Voiceovers for this episode were provided by Randy Ramos Jr. To see and hear more of his work, visit randyramosjr.com.